Morning, committee members, chair and committee members. As you all know, the measles outbreak, sorry, I'm trying to adjust things here. The measles outbreak that's centered in West Texas that continues to grow. A person that was from one of these outbreak counties had visited several locations in San Marcos, New Braunfels, and San Antonio area over the weekend, over the Valentine's Day weekend. So today's briefing will be providing a situational report on these exposures, as well as, importantly, our public health response to these exposures. And before I go any further, I want to acknowledge the staff, the key staff members who are involved in this outbreak investigations along with me, lockstep. Miguel Cervantes, he's our public health administrator. He oversees our immunizations and STI programs. I also have administrator over Marcom, Sonia Gonzalez, leads a robust team of marketing and communications team at Metro Health. We have two other key members. Stand up, please. They don't get the recognitions very often. It's the program managers for epidemiology division, as well as the immunizations. Epidemiology is led by Krishna Carmona, and immunizations is by Michelle Markham. Michelle Gilstrap. We have too many Michelles at Public Health. And I also want to give a shout out to the A team that we left behind, who are actually doing the work behind the scenes. They work very hard every day to safeguard this community's health. So thank you so much for what you do. And do it this way. Okay. So here's the timeline of events that happened with these exposures that we are talking about today. On February 23rd, this past Sunday morning, the Texas Department of State Health Services informed us about a potential exposure in our community involving a Gaines County resident who tested positive for measles and had visited or landed up in our community and you'll see the timeline. So based on the clinical history that was given to me, the period of infectiousness for this person is February 15th through February 24th. The person arrived in our community on February 14th. And this person, while infectious, visited all these locations. These are large public locations leading to large community-wide exposures. The person visited on the 15th, visited UTSA campus between 10 to 2, visited several locations, several attractions at Riverview, the Wax Museum, the Ripley's Believe It or Not, and Ripley's Illusion Lab at, from 2:30 to 5:30 p.m., and then ended the day on the 15th by dining at Mr. Krabby's Seafood in Live Oaks, and the exposure there was from 6 p.m. to 8 p.m. This person then left San Antonio the following morning. And so based on the history that was given these three locations, we consider these three locations as where we know community-wide exposures might have happened, because it is very possible that this person could have come in contact with, if not hundreds, but thousands of our community residents as well as visitors. We are a destination city. So we did have real great concern of potential large community-wide exposures at these public sites. Hence the need to alert the community promptly, and this was done later on the same day on February 23rd. This was the day that we were initially notified. We had contacted the place that the person was staying while in San Antonio, and detailed investigation and history was taken from the staff as well as other patrons, and we did not identify any possible exposure at this place of stay. Hence, that was not listed publicly in our press release. Because measles is highly contagious, and it can linger in the air for quite some time, for up to 2 hours, even after the person has left. Especially in close confined spaces, you see those exposure periods we've extended by 2 hours beyond the infected person's visit times. Some people think measles is just a little rash and fever. It can clear up in a few days, but I just want everyone to understand this is highly infectious condition. It's a highly infectious condition. 90% of folks who are unvaccinated who come in contact with a confirmed case can break down with the disease, can get the disease. So this is a pretty serious infectious condition. It spreads through air, it's airborne spread. It spreads through air when the infected person coughs or sneezes, and it is so contagious you can just get that by being in the same room as the infected case. And like I mentioned earlier, the virus tends to linger even 2 hours after the infected person has left, so it is highly contagious. The symptoms appear typically 7 to 14 days, and in some instances, up to 21 days after the contact with the virus. And the most common symptoms that you see are those listed up here: high fever, cough, runny nose, red watery eye, pretty non-specific to begin with. And within 2 to 3 days of this initial onset of symptoms, you tend to see white spots in the mouth, and within 3 to 5 days, the characteristic measles rashes appear. These rashes are flat, small, red rashes, typically begin in your hairline, face, and then spreads to the other parts of the body. Rash can persist about 5 to 6 days, and then they fade away exactly in the same order that it appeared. Anyone who's not protected against measles is at risk. So if you're not vaccinated, if you don't have immunity that is either vaccine-induced or natural infection immunity, you are at risk to contract this infection. It can cause serious health complications in folks who are at high risk for complications, and those are children, our babies and children under 5 years of age, pregnant women, folks with underlying medical conditions and weakened immune systems. In babies under 5 years of age, the most common complications that we see are ear infections, diarrhea, and we can also see serious complications if not managed appropriately and in a timely manner. It can lead to pneumonia and encephalitis, and the fatalities that we see with measles are typically because of pneumonia and central nervous system, CNS abnormalities and complications. Like I mentioned, the best protection against measles is the MMR vaccine. It's a safe and effective vaccine that provides long-lasting immunity. And the recommendation is to have 2 doses of MMR vaccine as a childhood. As a child, you should have received 2 doses of MMR vaccine. It is 97% effective against preventing measles. 1 dose is 93% effective. Now, as a child, the first dose is given 12 to 15 months of age. The second is 4 to 6 years of age. Now, older adults, they may receive 1 dose, and you're still considered up to date with vaccines, with your MMR vaccination. Here's what we are seeing nationwide. This is the cases and the outbreaks in United States. Now, measles was considered eliminated in the United States in 2000. Now, since COVID, we are seeing a resurgence of measles and outbreaks here in our nation, and this is primarily because of 2 reasons. Globally, measles cases are increasing, so whenever there is increased activity globally, I always say this threat of measles or a case anywhere is a threat everywhere. So it can easily spread into other communities, especially communities with low vaccination coverage. And this is the second reason since COVID why we are seeing a resurgence of cases and outbreaks, because the overall MMR vaccination coverage nationwide has fallen below the desired target vaccination coverage rate of 95%. At this time nationally, we have coverage rate approximately about 92.7% with regards to MMR vaccination coverage among our kindergartners. So what you see, the map that you see on the left-hand side, it's the cases and outbreaks in 2024. In 2024, the entire year, we had 285 cases in 33 jurisdictions in the United States with 16 outbreaks. In contrast, look at the map on the right-hand side. That's the map for 2025, and it is just February of 2025. We are already documenting over 100 cases nationwide, and with 3 large outbreaks. Here's what the situation here is in the state of Texas with regards to measles cases. And everyone knows this. We currently have a very large outbreak going on in the South Plains regions in Texas. But the first 2 cases that was reported here in the state of Texas was from Harris County. And that was the first confirmed reported cases in Texas since 2023. Now, this particular large outbreak that's ongoing, and we expect these numbers to change. The state is updating these numbers on a weekly basis. As of this morning, we have 146 cases from this outbreak, and I expect these numbers to go up exponentially, especially because of travel to and from the community, as we saw with the exposures that happened in our own community. 2 days ago, on February 26th, Department of State Health Services reported the first fatality in this growing West Texas measles outbreak, and this was in an unvaccinated school-age child. Again, a grim reminder that this can be pretty serious for our young children in the community. As far as Bexar County goes, we've had 4 cases in the past 20 years. Our last case was in 2019. We had 1 case in 2019. Prior to that, 3 cases in 2007. These 2 instances were travel associated. We did not see any widespread transmission of these cases as a result of these two instances. And that was because we had pretty high vaccination coverage in our community among first graders and kindergartners. It was close to 95%, if not higher in certain geographic locations of our community. At this time, our current MMR vaccination coverage among kindergartens has fallen 1% below, 1 percentage point below the desired target of 95%. And what's more concerning is there are certain pockets or certain geographic locations within our community, like the South and the West, where even though overall it may be, the vaccination coverage may not look bad, there are pockets with very low VFC provider coverage, and these are cause for concern, and we are intensifying our response efforts in these areas. And I'll talk about that in this slide. So here's since the exposure, or since February 23rd, when we got the initial notification, there has been a flurry of response activities, which I would group into these 3 focus areas. First is surveillance and public health investigations. This is the cornerstone of all public health response. It's twofold. First is we begin with timely contact investigations to identify all exposures, implement control and prevention measures to prevent the further transmission of infection in our community. That is the goal of all public health investigations, to prevent the further transmission of disease in our community as quickly as possible. So the day we were notified, I had a call with UTSA, which was one of the exposure sites, notified them, made them aware of this exposure, gave them all the recommendations, and offered any assistance they might need. Well, UTSA is pretty self-reliant. They have a robust student health services. They have infectious disease consults on staff, so they manage their exposures themselves and did a good job. They did a blast notifications to their staff and students and faculty pretty quickly. We also contacted the other exposure sites, the Riverwalk Attractions and Mr. Krabby's restaurant, and identified some exposures, and we have identified up to about 20 contacts or close contacts that fortunately majority of them were vaccinated, but they have been contacted, notified of their exposure, and educated on what to look for, right? So essentially what we are doing is asking these contacts, regardless of your vaccination status, please self-monitor for symptoms for up to 21 days. And fortunately for us, none of them have broken down with symptoms, and they are doing well. But every day we get about 60 to 80 calls. We are vetting those calls pretty diligently. The other step in our first response effort is identifying new cases. This is, again, our goal to prevent the further spread of the disease. We can only do that when we identify new cases as quickly as possible, because every single case that emerges it can result in about 12 to 18 new cases among unvaccinated. And this is how it gets widespread and gets hold of and gets a stronghold in any community. So our goal is to identify these new cases as quickly as possible, and we are able to do that because of because measles being a reportable condition here, not just in the state of Texas, but nation. What that means is healthcare providers, doctors' offices, hospital systems, school nurses, infection controls, ME's office, labs, anybody who makes a diagnosis of measles are required by state law to promptly immediately report that to local public health department. So what we do as soon as we get the notification is reach out to the case and do a detailed investigation. And the goal of the investigation is always establish the infection timeline, identify the source if we can, identify all those exposed, and then implement control and prevention measures promptly. The second focus area of our response is developing guidance and recommendations. We have developed guidances and sent out health alerts to our local provider community, healthcare provider community. 2 of them are already sent out. We get calls on, and we do consults on infection control, testing recommendations, isolation practices. So most of the providers, we work very well with the hospital systems and the clinicians and the doctor's offices here in our community. And those are ongoing every day, regardless of this particular exposure. We developed a guidance document for first responders. It was distributed to PD, EMS, fire, essentially, again, alerting them as to these exposures and giving them some guidelines, so infection control guidelines and precautionary measures that they can take should they encounter a case out while they're patrolling our streets. And then we work very closely with school nurses. In fact, Christina and her team attended a school, I think it was the East Side School Board, Northeast Side School Board Advisory Committee. And they had a lot of questions which we were able to address. We also have reached out to the Region 20. We are having a town hall with school nurses that's scheduled for next week. We have another one with school administrators scheduled for this next Friday. So we are moving at warp speed with regards to our response. We are also offering opportunities to host vaccination events should there be a need. But fortunately, our kindergartners are pretty high, even though it's not the desired target, they are pretty highly covered with regards to MMR vaccines, but we are keeping that option open. We also developed various guidance documents for the general public. The FAQs have been developed, and all these resources that I'm listing out are all updated on our website. That FAQ is a living document. I'm in a daily basis collecting questions that come up that we encounter either in our clinic or CHWs or CHPs block walking the street, any questions that they encounter. And if it's not covered in the FAQ, we do take a look at it, and it's updated. So that's why I say it's a living document. We update it on a daily basis. The third focus area of our response is outreach. We have reached out to our IZSA, which is Immunize SA partners. This is a big partner or stakeholder committee that assists us with our vaccination efforts, with our immunization efforts. And I am so glad to say that each one of them have responded back saying they are willing to assist and willing to collaborate, hosting pop-up events if there is a need. At this time, we are able to manage the capacity. Metro Health has the capacity to handle the pop-up request. But should we ramp up our response, we have already, in anticipation of ramping up our response, we've already reached out to these partners, and they are standing by and willing to assist. We are also looking to host more pop-up vaccine events, especially in those areas that I said has low VFC provider coverage, right? So we already had one event this week. There's another one on I believe this Saturday at Cortez Library. And the easy wins for us is reaching out to the partners that we worked with during COVID-19 to have these pop-up events. So we have reached out to all the libraries We have reached out to some of the churches that were our old partners, asking to see if we could host pop-up events pretty quickly. And as and when we finalize these details, it'll be posted up on our website, the location, the timings, and the dates as well. And then last but not least, we have a very robust, like I said, Sonia is here, we have a robust marketing and communication effort that is ongoing. Even before this exposure, we had already launched a massive vaccine campaign, which is Riskless, Do More. We had several measles prevention and crisis communications through our social media and various other channels, modes of communications. Since the exposure, the news stories was widely publicized, were widely picked up by all forms of media, and you see all those shares and impressions listed out there. We will soon start, and this is going to be pushed ahead of the scheduled time. This was supposed to be released sometime later in the March, but this campaign is a new campaign. This is the HHS campaign. Let's Get Real. That'll be launching pretty quickly ahead of the pre-scheduled time. And then, of course, as usual, we will continue to update our website, continue to update the community, keep everyone aware of what's going on. And these are some of the resources. We have great resources on our website. We have links to the state and CDC website. And that pretty much concludes the presentation. And thank you so much for your time. Happy to take any questions.
Thank you so much, Dr. Kurian, and to the Metro Health team for quickly bringing this item. As cited, it was a request a couple of days ago, but I think you all being prepared to present demonstrates the infrastructure and framework in which Metro Health Department is prepared and doing the work, whether there's exposure or not. That work continues, and just grateful for the Metro Health team and all that they do in ensuring that we're safeguarding our community. As Dr. Kurian mentioned in the presentation, there was exposure that had been reported in the media, and out of abundance of caution, we thought it was important to request a briefing because I know my team is fielding calls from constituents that have general questions around measles exposure and what processes are in place in terms of getting access to vaccinations. So just thank you all so much for being prepared, as always, to equip community with the information. In terms of some of the numbers that we're seeing, and I know that they're changing, and you touched on it in terms of the impact that this can have on children in particular, especially if they're unvaccinated. I'm curious to, and I know you mentioned it too, you're already talking to independent school districts, you've already presented to independent school districts, but I'm thinking about our pre-K for SA students and what work is being there to ensure that we're mitigating any potential, and I know we're not there yet, right? But in the case that there is, what steps are we taking to ensure that there's a plan for our little ones at pre-K for SA in terms of potential exposures?
So that's one thing I forgot to mention. In the schools, when doing those outreach to schools, we are doing outreach to schools, childcare facilities, and pre-K for SA as well. We are in constant communication with them. In fact, we did send them the guidance documents for childcare facilities and schools with regards to infection control. So we are in constant communication.
And you answered one of my questions in your presentation, because last night at a neighborhood association, I was asked, how is all this information relayed from one entity to another? Mm-hmm. And you emphasized that whether there's an outbreak or not, that it is information that is shared by an entity. So can you just walk us through that piece one more time in terms, if you go get tested, how that's they're required to relay it to the Metro Health Department?
Correct. So I'm going to take one step back from the testing. The bread and butter of all our surveillance activities is those reportable conditions list. Mm-hmm. We have about 77 plus infectious conditions on that list. And that list is the one that I was referring to, where any provider, any lab, any school nurse, ME's office, anybody who makes a diagnosis of any of those infectious conditions are required by law to report to the local public health department within that designated time frame. And I have to say, I'm very proud of this community. We have a great compliance with our hospital systems. They are also part of our public health system, right? So we have a great partnership and collaboration with our hospital systems, with doctors' offices. Christina's team is pounding the pavement all year long, educating these doctors' offices about these reportable conditions. Infection control nurses are pretty much calling regularly. So you hear us talk about all this only when there is a crisis, but this is the work that is ongoing year-round behind the scenes. We get about 60 to 80 calls on any of those conditions on any given day. And then throw in an outbreak, those call volumes go up. So we are working, and if you don't hear from us, it is a good thing. You hear from us only when there is a crisis or an outbreak.
Thank you.
And does that answer your question?
Yes, ma'am. And during the 3+9 briefing, one of my colleagues, Councilwoman Villagran, mentioned whenever we experience an emergency or an outbreak, we know that it's primarily concentrated in specific areas. And I appreciate the assurance that you are going to lean on the COVID partnerships that were established, because we know where those exist, right? It's primarily in the south side, west side, and east side. So again, right, I really appreciate that you are emphasizing that the infrastructure to provide access to care, if necessary, is ready to go, and you're already having those ongoing conversations with community partners. Those are my questions, and I'll hand it over to my colleagues. Councilwoman Phyllis Villagran.
Thank you. Thank you, Dr. Kurian, for coming and presenting. I know you're doing a great job, but I always hold my breath when you're coming up, because I know it's going to be something where it's like that list of 77, because I've heard you say that before, and I was like, and then I want to look at the list, and I'm like, don't look at the list. She'll come.
Yeah.
She'll come when she's supposed to.
So the moral of the story, Councilman, is invite me back when the times are good, right?
Yes. So I spent the morning with Harlandale Independent School District, and it was a great way to start the morning, because they were doing a resource fair for children with disabilities. But as I'm there, I know I'm walking away having this update on measles. And I'm like, and I'm telling some of the health workers there, it's like, it's 2025, and I'm having to go get an update on a measles outbreak. And we're all like, people need to get vaccinated. And I am so much appreciate your efforts and applaud what you're doing. I think the one thing we also need to communicate, and Claude, and I know the communication team is out here, is when we talk about the vulnerabilities, especially for children, and children on the south side, which we have juvenile diabetes. There's a lot with asthma. There is cancer in and around those communities with a teenage, well, lots of people, but I know it impacts our youth and the teenagers, it seems to. So I want to make sure that we're getting the message out of who can get vaccinated and when, and what information they need to have. The other I'm concerned about is that a lot of people during the, not a lot of people, some people had children during the pandemic, decided to expand their family. And I think those are the ones that we need to make sure, are you up to date on your vaccinations with your child? Because the risk is real. We know that environmentally, it can easily spread, and we learned from, I believe, the pandemic that people don't always wash their hands like they do or cover their mouths when they cough. So I think it's really important that we get the message out to make sure that they're moving. On slide number 3, if we go back to slide number 3, so this dark blue, which is in Texas, that is because we've reached over 100 now in 2025.
It's the other slide, right? Yes.
Oh, I'm
yes,
sorry, 4.
yes,
I'm
yes,
sorry, 4.
Yes.
Yes. Okay, so.
We have, as of this morning, we have 146 cases reported.
Okay. And my concern is, and it's going to be spring break. And I looked at some of those counties, and I'm like, okay, students from those counties are going to come back home to San Antonio or back home to their bigger cities. And I'm glad that we're getting ahead of this, but I think we need to, and I know that y'all are doing that, prepare just for the case to come here in Bexar County. Because the counties that and we already learned this with this past report on the outbreak, is that people from these counties are coming home from school, are visiting San Antonio because it's spring break, and it's a tourist destination spot. So how do we prepare our local community to make sure that they're masking up if needed, or, what they can do because it is highly contagious, and making sure that they understand what their vaccination status is. Sign me up for the pop-ups in District 3, and I'll work with you with all, we have a lot of school districts. I know they're very helpful, but I do have kids getting homeschooled, kids in charter, kids not in pre-K yet. So please let me know what my office can do for the pop-up, and just as we look through the updates, when can we, and I know it's hard for you to answer, when should we expect an update? Like, are you just going to provide that on the website via dashboard, or will you send, or will our media that's here probably ask you the question and then
Yeah.
get that out there?
Yeah. We can have something, I think Mr. McCurry can work out something for regular briefings. You brought up a couple of points, and if I may take a few minutes to respond to that. These exposures, we expect to see any cases coming out of these exposures by March 8th. This is taking into consideration the incubation period. So that doesn't mean we cannot have other cases of measles, right? Measles, we can have some international traveler who's coming, not necessarily associated with this exposure. But cases with these exposures are expected from now until March 8th. So if you don't have any cases associated with the exposure after, don't have any cases until you won't hear from us. We do have, like I said, it's not just these cases associated with this exposure, contacts associated with this exposure that we are investigating. We do this year round. So people are traveling globally. Globalization is real. Travel is pretty easy. So we do get these suspect febrile rash illnesses report. And we do have few handful that we are monitoring. We coordinate testing with the providers, and we don't jump the gun and come out and talk about the suspect cases unless we have all the facts straight. So if we have a confirmed case, absolutely you'll hear from us. And with regards to vaccines, I just want to say I'm a big believer on vaccinations. Surprise, public health professional, right? But vaccines have really significantly improved childhood survival. There's an interesting study out in Lancet. I think everyone should read it. Past 50 years, vaccinations have saved close to 150 million lives. That's big. So yes, everyone should review their vaccination records and be up to date with their vaccines. And I want to take this podium to send a plea out and urge the community. We say this in every phone call we get. If you are sick, please stay home. Exclude yourself from public settings. Don't go to North Star Mall, or don't go to the movie theater. Don't go to, large restaurants. Don't walk on the riverwalk. If you are sick, please exclude. Don't go to schools. Please exclude yourself. Get evaluated, and let us rule out, along with your provider community, rule out any infectious diseases like measles that could be highly contagious and putting thousands of folks at risk for exposure.
Councilman Dr. Rocha Garcia.
Thank you, Chair. Thank you so much, Dr. Kurian, for the very informative presentation. Do you have a breakdown of the current vaccination rates amongst some of our most vulnerable residents in San Antonio?
I don't have that breakdown just yet. It's very difficult to get that because vaccines are a requirement for K through 12. So we have a good handle on that coverage, which at this time is about 94.2%.
Do you remember, or do you know when Metro Health started providing vaccinations, access to vaccinations in San Antonio?
It's since, I think, for the past 35 years.
Okay, so I was just trying to make sure then that we have a pretty good steady record then, it looks like. Okay, and then can you remind me how long it took for you to inform on this first case or potential exposure? How long was that? How long did it take you all to do
I was notified during the AM hours, early mornings on Sundays, and all public health crises begin on Fridays and end on Mondays, right? So on Sunday morning was the notification, and by 5 p.m. on Sunday, we had notified all potential sites of these community-wide exposures and send out a press release.
And I wanted to highlight that, and I just wanted to take the opportunity to say that I appreciate you all, because while there's other departments in the city that don't work on holidays, or that say, oh, it's Sunday, I'll have to get back to you on Monday, Metro Health's always working. And so shout out to all of your healthcare heroes that you have, behind you. And I think that's one of my frustrations. Like, we as elected officials, we work 24/7, we're expected, and so especially in times of crisis. And so again, I just can't tell you how much I appreciate you all always being there for the community. On the children's immunizations that we're providing, are they free? And if they are not, how much do they cost? Help me understand. I know that there's like chip available, but help me get the message out to our residents.
So MMR vaccine is widely available, easily accessible, and covered by most insurances. Right. So the vaccines we provide on our clinic are through the VFC program, Vaccine for Children's program, and through the Adult Safety Net program. And these vaccines are targeted specifically for those uninsured and underinsured folks who don't have insurance coverages to come and get those vaccines. So if you're insured, go to your pharmacy, go to your doctor's offices. Leave the opportunity to provide that service at public health clinics and pop-up events to the uninsured and underinsured, because those vaccines we get from the federal government and the state government at no cost. We charge minimal administrative fee. It's just, I think for VFCs we charge $14.76 or something like that, and for ASN 22. But one thing I want to say, we never declined services because of somebody's inability to pay even that nominal administrative fee.
Wonderful. Thank you so much for that. And Dr. Kurian, another question that we have been getting as this continues, and in Spanish it's called sarampion. And so I get that question from a lot of the population that I've been representing, and they're trying to tell their neighbors not to be afraid to come to Metro Health if they need that service. And so help me understand, like, what do you ask for when somebody comes to ask for vaccination? What kind of identification do they have to provide, et cetera?
We expect you to bring your vaccination records, because we want to make sure we are giving the right vaccines. If you've already received it, there's no point in revaccinating you with something else. At minimum, bring in your vaccination records, but if you don't have that, we do, like I said, we never turn folks away. We have a way of looking up for your vaccination records if you don't have it, especially if you've received vaccines here in the state of Texas. So if you have your vaccination records, please bring in, and this is just so we can serve you better.
Got it. Is it birth certificate? What do they have to show?
For vaccination records, no. For receiving a vaccine, we are not that stringent. We have seen, and it's as long as we have some records on how old you are or how old the child is, I think that should be. But it's not a requirement to receive services.
Okay, thank you. I appreciate that. And then I appreciate you already meeting with Region 20. I know that you have that coming up as well. Would it be helpful for us to have just like a common messaging? I know that you all did provide something, but just kind of like updates. I know that the community is just worried and hyper aware, and so any updates that you have that we can share on like today's numbers, et cetera, like, do you think that it would be helpful as maybe cases start going down, et cetera?
We don't have a case yet here in our community. You're talking about state of Texas cases. We certainly can make those arrangements. And like I said, the FAQ is a living document. Every time we make an update, we can make arrangements to send it to all consular district offices, and you can disseminate it further. It's always been posted up on our website as well.
Great. Thank you so much, Dr. Kurian. Thank you, Chair.
Councilmember Dr. Kaur.
Thank you so much, Chair, and thank you for this presentation. I want to echo Dr. Rocha Garcia's comments that you all are a super important department that does work day in and day out, and not that any of us have favorites, but we do all really appreciate the work that you do. I know Dr. Jacobs and you all get a lot of accolade from us. I actually had that same question about data, so that from the 94%, is there a way because if I'm a parent and I'm enrolling, I can waive my right to submit vaccinations. Is there a way to access from schools that information to have conversations with those parents?
Vaccine exemptions?
Yes.
Yes, thanks for bringing, that's very important point to bring up. Texas is one of the 16 states in the nation that has very broad vaccine exemptions laws, right? Most states allow only medical exemptions, but we are one of those 16 states in the nation that allow, in addition to medical exemptions and religious, also conscientious exemptions, which is pretty easy. A parent can do an affidavit and object to it, and that is acceptable. And this is a real threat for us. This is cause for concern. If you look at the vaccine exemptions data from 2013 up until recently 2024, in 2013, the exemption rates were 0.79%, way below 1%. Currently, it is close to 3%, 2.81%. And that is because of these broad vaccine exemptions laws.
And how many of those do you know how many were those conscientious?
I can get it. I don't have it at my
curious.
fingertip. Yes, we can get that. But again, like I said, vaccinations are important. They save lives. We've been able to eliminate or eradicate deadly infectious diseases like smallpox because of vaccines. So it's very important.
Is that protected information, though, for at the schools? Like, can the schools provide you all with the list of families that have submitted those?
That is confidential information. What we get is the overall rates, not the
Percentage.
breakdowns, yes.
Okay.
And it's
Because-
available at the TA website. If you are wanting to know by school districts, it'll tell you.
But it's protected on who's submitting that,
Yes.
so you don't know. But the
Yes.
school leaders technically would know.
Yes.
So that's why with your campaigns, when you're going to the schools and sharing an outbreak situation,
Right.
they would know who to directly reach
Right.
out to.
School nurses are already reviewing their vaccination status among their student population, and this is done because should there be an exposure in the school, they should immediately identify who's at risk for exposures and disease. These are unvaccinated children, and if there are unvaccinated exposures at the school, our recommendation is regardless of symptoms, whether you're symptomatic or not, if you're unvaccinated, you have a confirmed case in your school, you are to be excluded for 21 days from your date of last exposure. So school nurses are already prepping, reviewing their vaccination records, identifying who might be at risk, even
Yeah.
before we have a crisis at
The
hand.
challenge there is a lot of schools don't keep their school nurses, so it's like, the
That's
job
true.
of a business secretary. And,
That is true.
But that's not a debate for for this committee. But the next question I wanted to just ask and commend you all on is the education awareness. And I think a part of the reason why that's even more important is because we see this increase in rate of people choosing not to get vaccines because of the, media craze on on the side of that they're not helpful or they're not needed.
Sure.
And so have you all thought about doing a concerted effort? And I know you all are already in terms of the signs that you said on that slide, but getting creative with different types of education awareness. Ryan on my team was doing some research, and there's different offering incentives or gift prizes, or maybe even having a vaccine education center where people come to. These are some ideas that other states are doing.
Yeah. No incentives at this time, but we are using that's one of the campaigns we are working on, using influencers, folks that community, they have some credibility within their community. Right? Me coming saying get vaccinated is completely differently perceived than somebody who lives in the community, is trusted messenger of that community to it. So those are some of the educational campaigns that we are working on.
I love that. Yeah. I think continuing to even maybe partnering with the business community to see how they can host, fun events and things like that, because I think we have to get even doubly creative now, given the opposition coming. That's all I have. Thank you so much, Chair. Thank you so much.
Thank you. Councilman Dr. Rocha Garcia.
question, Dr. Kurian. Is there any way that we can maybe focus on medical desert areas and make sure that we have vaccine access there?
And that's exactly what I meant by when I say low VFC provider coverage.
Perfect.
Because
Okay.
these are the providers who provide service to the uninsured and underinsured, right?
Perfect.
Folks who are insured can get access in pharmacies and doctor's offices. So we are targeting actually those.
Great.
Yeah.
Okay, thank you. Thank you, Chair.
Thank you, Dr. Kurian. We appreciate y'all presenting to us today to demonstrate to the community that there are safeguards in place, and you all continue to do the work, whether there's exposure or not. You are behind the scenes fielding those calls and collecting the data and sharing the information. So thank y'all so much to the Metro Health team. Thank you,
Sure.
Dr. Claude Jacob and team.
Thank you for the opportunity. And we don't lie when we say we don't sleep. We don't sleep. Thanks.